Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we have a question about what to do if you get an endodontic lesion on a tooth, whether you're getting ready to start braces or aligners or it's in the middle of the treatment. And ultimately, my answer is that says depends on what the endodontist says. I don't make that decision, the endodontist does, and they give it to me in writing. If I obviously I'm an orthodontist, so I might do things a little differently than you if you are a GP. Where you are the primary care dentist. But I'm going to tell you what standard of care is. Standard of care is, of course, to do a full oral health workup before starting treatment. Usually, I'm going to get a GP to go ahead and sign off, saying that there's no cavity, there's no endo problems, there's no perio problems. Then they're going to sign off on a piece of paper. Obviously, I'm going to take a panoramic x-ray. I can see things in that too. If I see something, or if I see even a cavity that's on a tooth, I'm going to punt that patient back to the GP and ask him again, you know, please, evaluate decay on this tooth, or please evaluate pathology on tooth number 29, and then they get to do it. If somehow the endodontist and the GP thinks it's okay to treat and there is a lesion that maybe hasn't resolved that they've worked on and it's being monitored by them, not by me, by them, and they write down in writing that they're going to accept the risk and the liability is not on me and they're going to have to write all of that, then I might treat it, but I'm probably not going to move that tooth, which means I'm not going to do braces. I'm going to do aligners so that I can lock that tooth, especially if it's a molar. It's usually not a huge problem. But if there's major movement and we need to sequentially distalize or expand, well, then I'm going to move that tooth. So the more you move a tooth that already has an issue, the more likely it is going to blow up more or cause more damage. So I usually will not treat. I'll also do the same thing. Of course, every 6 months, you're supposed to be getting, go back to your GP, go back to have an oral health examination at your GP, even if you're in braces or aligners. And every year, you should be getting a progress x-ray with your orthodontist. So this really should not be happening if you do what you need to do and you're not rushing cases. The problem is a lot of you are rushing cases and, patients like, oh, I don't want to get that fixed because that means I have to, but better to get it fixed than to have something blow up on the patient or damage other teeth or damage the bone or fall out. And that could be made worse by doing orthodontic treatment with a tooth that is infected. All right, thanks so much.